Access to dental care continues to be the story of 2025. And in this video, I want to highlight some dental office participation studies that I have found and also talk about some of the factors at play that could affect some Indiana families with their access to dental care. So I found an article and a study from the Journal of the ADA for Indiana dentists dating back to 2018. So the study includes 2,037 Indiana dentists that renewed their license in 2018. Of those just over 2,000 dentists, 802 were continually active in Medicaid during the period of 2014 to 2017. That's about 39%. The study also then talked about with Medicaid expansion, and Medicaid expansion happened in 2016. An additional 5.7% of dentists in dental offices started accepting Indiana Medicaid and HIP. So very interesting to me, but still across the board, less than 50% of Indiana dental offices accept Indiana Medicaid or the Healthy Indiana plan. So that to me is pretty interesting. So knowing over half just have it listed on their website that they accept it. Sometimes that number gets artificially inflated as well, where they're listed that they accept Indiana Medicaid and Healthy Indiana, but when you actually call them to schedule, they might tell you a different story. So I think those numbers are slightly inflated in a 2025 perspective, but I still think 40%, 35 to 40% is a healthy number. So, and I say that because when looking at active 2025 data, and unfortunately there's not very good up-to-date data, see previous videos on this, but with Medicaid being both a federal and state policy, it's really hard to get accurate up-to-date information. But some of the factors that are at play to extrapolate that data from 2018 to see where we are now, absolutely a big factor is the Medicaid reimbursement rates. So in Indiana's Medicaid fee-for-service reimbursement for adult dental services is about 49%. That's not, honestly, that's not great, but it's not bad when you compare it to the average. The average Medicaid reimbursement rate is 30%. So we're about 20% above the national average, but still when you talk about the absolute dental inflation that we have felt in operations over the last 5 to 10 years, 50% reimbursement rates get really hard to pencil when wages, equipment, rent, everything continues to go north. So that's a factor at play, and still the goal for the plan is to reduce the administrative burden, but I don't think that has actually happened, which is why I still think more the 35% active dental offices participating in Medicaid is probably more on the nose. There's a lot of additional legwork and paperwork and credentialing that goes into accepting Indiana Medicaid and the Healthy Indiana plans. So thought that was really interesting. I am going to attach a blog with this as well for Indiana families that are looking for dental offices that will accept Medicaid and HIP, what the best way to go about finding those offices are. Because again, like we've already hit on in this video, sometimes the office can be listed on the website that they are active in those programs, but when you go to call, they actually are no longer scheduling or accepting those patients. So some of the best ways to do it are to get on the managed care or HIP websites, and you can use that as tool to find providers that are in network. So I have all of that listed, but you have Anthem, MHS, MDWise, CareSource, Delta Dental of Indiana, and DentaQuest. Those are all of your managed care entities. And then Indiana Medicaid also has its own directory. So comment down below. Let me know what jumps off the page at you guys. We're going to continue to make more and more content about dental office and dental care accessibility, in particular from the Medicaid and managed care perspective, because as we know, the Fed is looking at cutting Medicaid benefits, and if the Fed cuts the benefits, the states will have to follow suit. So it's going to be interesting to see where this goes. Comment down below for more, and I hope everybody has a great Friday.